Alex?
Okay, thank you, Scott. Well, 8:15. 1 in 8 couples struggle in silence with their infertility. And this really came up because Anne Hathaway recently announced her pregnancy on Instagram. And after she announced that she was pregnant, she acknowledged her infertility issues, writing, quote, "Please know it was not a straight line to either of my pregnancies." And she mentioned how she's sending lots of people love who are dealing with it because she knows exactly what that feels like. And in fact, so many couples do. So we have fertility specialist Dr. Deanna Brasile, a mother of one, says women and men under and over 35 can face obstacles. She's joined by Deanna Murray, who was told that she had a less than 1% chance of conceiving before delivering her daughter 3 years ago now?
Yes.
3 years ago. And Jessica Wardell, who is preparing for yet another round of IVF. So you still have hope and you're still working to get that. So we want to talk about all this and how different women, they go through different things, as well as men with their couples. But the interesting thing is, I think before we thought 35 and up, that's the only time you should really worry about this. But we're seeing actually it's not just 35, doctor?
Absolutely not. The numbers seem to be just as staggering for women under the age of 35 as well, for a multitude of reasons. I mean, certainly it's obvious as one ages that the quality of eggs can decline, but under age 35 that may not be the issue, but there are many issues that can potentially occur at that age.
And when you say many issues, before we get into your stories, what is infertility? How does it happen?
Well, it just simply means that the woman's been attempting to conceive. Typically, we say for over 12 months without success if she's under the age of 35. For over age 35, we consider that interval shorter because we don't want them to wait too long before they seek our help, and that's then shortened to 6 months. But essentially, it means without success of conceiving or otherwise carrying to term.
Okay, so let's start with you, Deanna, then. When did you realize you were starting to have trouble?
I actually knew when I was 18 that I was probably going to struggle by the time that I wanted to have children because I suffered with a lot of pain during my monthly cycle. So I was always told that that I could have endometriosis, and that was something that I knew that I had off the bat, right off the beginning.
Okay.
As I got older, the pain increased, and I realized not until
I was like cramps, menstrual
cramps, pain on period, off period, in between. 80% of the time I was in pain, and it just increased as I got older. So I wound up having fibroids, cysts, endometriosis, a damaged tube, polyps. I had it all.
So at what point did they tell you then that you have a less than 1% chance of having a child?
When me and my husband were trying to get pregnant, we tried for 5 years. Not having answers from doctors,
and
being
when you
ignored.
say try, did you do IVF and other things?
I did not go through IVF, but we were just trying and seeing different doctors. I hadn't even gone down that path yet. And then when, I want to say 5 years in, I just, going through cycles of depression, and it's just like something's wrong with me. Finally met with a doctor and realized that I needed surgery. And it wasn't until after surgery, the less than 1% chance that I was given.
And the surgery was for the fibroids, or?
Fibroids, cyst removal,
to take care of all that.
And my tube, I had a tube removed as well.
Okay, so then how did you come to ended up having your 3-year-old?
Between the surgery and honestly, it's an act of God. Like, my body was broken, and to have one tube and less than 1% chance, and IVF was on the table, but I just wanted to live. Like, I was just really struggling, and I took time off to just live and heal and pray. Me and my husband are very spiritual, and a year later, I was like, I'm pregnant.
And this happened?
Yes, and she's beautiful.
In 3 years, what a blessing, what a blessing. So let's talk with you, Jessica, because when did you start to realize then that you were having some issues getting pregnant?
Yeah, so my husband and I were married in June of 2018, and we started trying right away because we were kind of on the same page, really wanting to start a family. And we tried for 6 months, and I had heard 35 and over, so I was actually 35 at the time, so I made an appointment right away. So it was about 6 months in that we made an appointment with Dr. Brasile.
And then how many rounds of IVF, or when did you start doing IVF?
So we actually started with what's called intrauterine insemination, or IUI, and we did 4 cycles of that first. before we even kind of started attempting IVF.
Well, before you keep going there, I want
Yeah.
to bring in the doctor because,
ahead.
first of all, if you're having issues getting pregnant, how do you even know where to start? You just mentioned you didn't start with IVF. How do you know what avenue is right for you?
Well, we do our diagnostic tests at the beginning to ascertain the reason for their infertility. And so certainly if a woman has bilateral blocked fallopian tubes, like both tubes are blocked, then she's going to need IVF, which basically allows us to fertilize the egg outside of the body.
Okay.
Because otherwise the eggs have to be transported through the fallopian tubes. And if their highways are closed, no travel is going to occur, right? So that's how I tell my patients. Severe male factor. Typically, if the sperm count is significantly low, there won't be enough sperm for anything to work other than IVF. So it depends on what the diagnostic tests reveal. For
And
many
that's important to mention, right? Because I know that you said earlier that my body was broken, and we say as women, oh, I have issues, it's a problem. A lot of times it's not just the woman.
Sure.
Right? And it's important we don't internalize it and think it's just on us.
Absolutely. Up to a third of the time, it's actually a dual factor.
Wow. Okay. So then, and when you mention cycles, when Jessica's talking about that, I also think that we should probably mention, I mean, how much of a struggle it is and how intense it is to go through that.
It is.
How long is a cycle?
Typically about 30 days. They usually tend to be a little bit longer than the normal menstrual cycle if you're utilizing a drug called Clomid.
Okay.
And that's often used in conjunction with an insemination. So from the time that she begins her period and starts the Clomid to the time that she finds out that she's not pregnant and gets her next menstrual period is usually 28 to 32 days.
Okay. And in that time, what has that been like for you, Jessica, waiting and trying to...
Yeah, so you know, any woman that has struggled with infertility knows of the dreaded 2-week wait. So it's painful. It's painful. You're on constant high alert, looking for signs in your body that you may be pregnant, that you might not be. It's just a really, really tough time. And then to get the news at the end of that 2-week wait, that's not what you want to hear. It's really challenging.
And let's not forget, prior to that point, prior to ovulation, she's coming in to see me every few days sometimes.
Wow.
And that's a lot of strain, especially for a working person who has to time off from work and then to drive to my office and sometimes deal with traffic around our office and things like that. It's a lot of anxiety.
So Jessica, what's your plan then? Are you just gonna, you guys are gonna keep trying?
Yeah, so we took a little break over the summer and relaxed and enjoyed ourselves, but we're actually planning an IVF cycle probably early next month. So I like hearing success stories, of course, and I'm inspired, and we're hopeful. Obviously, I'm in good hands.
So, doctor
yes, exactly. So we're very hopeful that the next time will be a success. So
that's very true. So Deanna, thank you for being here and showing her, giving her the inspiration to keep trying. Because you never know. You never know what can happen. My own mother, she had infertility issues, and when she had given up, that's when they ended up having me. So I think so many women can resonate with you. So thank you so much for coming in and sharing your stories.
Yeah.
Thank you. Yes, and thank you, doctor.
Of course. Thank you for having us.
Thank you.
All right, we're going to take a break.